Mr. O'Dwyer, what are the basic pressing needs for European hospital managers?
Well, today we're looking at sustainability in our conference here in Bologna, this beautiful city of Bologna, and we're meeting with colleagues to look at the sustainability of healthcare right across the system. We're looking at a level of integration because healthcare is not all about hospitals. It's about developing a pathway of care to try and ensure that the patient is treated at home or as near his home near to his home as possible. And of course, if he needs complex or she needs complex care, then the patient should be sent to the appropriate hospital with the necessary skill set to deal with the patient. But the pathway of care is the model we're all looking at across Europe. And obviously, we've had significant austerity challenges right across Europe. And we have been endeavouring to support colleagues right across Europe on those issues. We also are sharing best practices across Europe, and we're sending colleagues from one country to another to gain some experience and also to run seminars and workshops to share best practice in all of our hospitals throughout Europe and indeed outside of Europe, because we have very strong representation in Switzerland, very strong representation in Norway, etc. So it's not just confined to the EU. And I suppose the other issue that the association is very focused on is to ensure that we influence our legislators. We influence our legislators about the healthcare needs, not just of our patients, which is really, really important, but also of the healthcare, the carers, the professionals, the clinicians in the service. It's really important. So legislation is important for us to deal with legislators, both locally and at the European Commission and European Parliament level. And we also have a strong association with HOPE, with the International Hospitals Federation, and also indeed with the UN and the World Health Organization, because we link in, some of our members link in, and some of our members are on boards of all of those organizations. So we try and look at best practice, not just at a European level, right, at world level. And some of our colleagues now will be going to the International Hospitals Conference down in South Africa at the end of October, early November. Within our association, we have a number of subcommittees that look at issues pertaining to health in every area. For example, I'll give you a couple. Mental health. There's a huge issue at the moment in some of our countries with suicide of young people, stress and pressure of young people. So our mental health subcommittee is working tirelessly with colleagues in Europe to try and see what we can do to assist the prevention of suicide. And we're looking at good models in a number of our countries where that is a problem. We're also looking at European affairs. We have a very strong European affairs committee. Again, not just to lobby, but to share good legislative practice right across our member states. Because, we have what some people call the old Europe and we have the newer members. But as far as we're concerned, this is Europe. This is our Europe, and we want to make our Europe a much better place for our community to live in and indeed for our staff to work in, and to ensure that if there are challenges and obstacles in one area, we're there in a position to help colleagues as we go through our daily chores with the various challenges as we have. And we have a lot of challenges with, in some countries, long waiting lists, in other countries, a lack of resources because of legacy austerity measures. The other committees that are very important to us is IT. Our IT committee works in partnership now with the board and with the executive committee, but we're also looking now at innovation, where we will bring pharma, IT and healthcare deliverers and researchers together to look at the concept of a European health innovation hub. And my God, that would be a fantastic development, and it's something we're looking at over the next number of years.